I was almost 57 when my husband said to me, "You're getting older." "So are you," I said. Then he said something that would change my life. He said, "I don't need your kidney right now, so maybe you would want to donate it to someone else." My heart stopped. I immediately knew it was time to start testing to donate my kidney. Don't be like me and wait 20 years to decide if kidney donation is right for you. The time is now to break the silence and share facts about living kidney donation. In this 15-minute video, I'll discuss the options, costs, benefits, workup, and the process to get started. Keep watching if you want to learn more. And if not, you can push stop and go watch some funny cat videos. Why should you even care about living kidney donation? Well, you likely know someone who has chronic kidney disease and needs a kidney, and that's why you're watching this video. Maybe your family, friend, or stranger is on dialysis or getting close to needing dialysis. They likely have been worked up and are on the kidney transplant waiting list. They only have a 1 in 5 chance of receiving a kidney, and this is based on 2018 data. If they don't get a kidney, they will die, go on dialysis, stay on dialysis, and unfortunately, eventually die on dialysis. So what's the typical solution for finding them a kidney? Register to be an organ donor at death. Well, about 60% in the US are registered, but guess what? Less than 1% of the people will ever donate. I've been registered for years and thought that meant I would donate. Nope, I was wrong. But why is that? Well, 3 main reasons. 1, kidney must be healthy. 2, the way you die matters. Typically, these are people on a ventilator, they've been brain dead, and that's often from a car accident or a drug overdose. And the family must consent. Hospitals will not take your organs, most of them anyway, without the family consenting. So registering really doesn't even mean you'll donate, even if you're healthy and dying the right way. This graph shows all organs. The green shows the number of donors. The blue is the number of organs that were transplanted, and the pink is the waiting list. That's a lot. There are 90,000 people on just the kidney transplant waiting list. The gap is much larger than we can fill just by registering to be an organ donor when we die. This is a partial solution, but it's not solving the huge problem that exists. This is deceased donation, and the wait time for this kidney on average is 5 years. Imagine a world where instead of going on dialysis or waiting for years to get a kidney transplant or dying on dialysis, that there was a list of living kidney donors waiting to be matched for someone with kidney disease, and there was no wait time. I'm Glenna Fry. I'm a nephrology nurse. My family has kidney disease, and my daughter Amanda and I started the nonprofit Kidney Donor Conversations. Our mission is to provide education and support for living kidney donation. We want to break the silence and help you understand this process. I'm guessing that you are not typical, and you might be interested in another solution beyond deceased donation. Dialysis is okay. It filters about 5% of your blood compared to 1 healthy kidney, and all the other kidney functions are lost. And that's why people don't feel well on dialysis. A kidney transplant is better. With a deceased kidney transplant, people live 10 to 15 years longer, and it lasts 10 years. With a living kidney transplant, there is less wait time, and it lasts almost twice as long as a deceased. And getting a transplant before starting dialysis gives the best outcomes and the longest life. That is called preemptive. In general, a kidney transplant provides a better quality of life, more free time, more stable blood pressure, hormone, electrolyte levels, higher rates of employment, and a decrease in symptoms. So how does a kidney transplant work? Basically, your kidneys are removed in surgery and placed in your recipient. Typically, the 2 diseased kidneys are left in place. And now I'll discuss 3 ways to be a living kidney donor. First is directed donation. You want to donate your kidney while alive to a specific person, like your friend, mother, son, daughter, and you're both compatible. That means your blood type and tissue typing is compatible. But what if you want to donate and you're not compatible? You may want to give your kidney to your friend, but you're not a match. So let's pretend that this is you, this is your friend, but you don't match. All of you, and there's another pair like you, all of you go into a computer program and they end up matching you with another recipient and your friend is matched with another donor. This is called a paired exchange. But don't worry about the match. Someone who is willing to donate a kidney can still donate, even if they're not compatible with who they initially wanted to donate to. And they can do this through the paired exchange. Third is non-directed donation. You may want to donate to just anyone in need. You don't care who gets it. You just want to help someone prevent or get off dialysis. And that's what I did in 2017. Donating a kidney to a stranger is also called altruistic or Good Samaritan. Your information goes into a computer program and they match you with someone who needs a kidney. Often these matches can be better than a directed donation because more people are in the computer program and you might find a better match. A better match means the kidney will likely last longer for the recipient. And isn't that what we really want for those with kidney disease? The best kidney and the longest life? Advanced donation is a type of non-directed, and this is how it works. So this is you who wants to donate a kidney to, say, your daughter. But guess what? Your daughter doesn't need a kidney right now. So you decide to donate your kidney now to a stranger. So this is a non-directed donation. And your daughter now gets a coupon for a kidney or a voucher so that she later, when she needs it and goes into kidney failure, submits the voucher and they match her with another donor and she gets a kidney transplant. That is exactly what I did with my daughter, Amanda. She has a voucher in case she needs a kidney in the future. Another amazing benefit of non-directed donors is the potential to start a kidney chain. So you remember all those pairs in the computer that were waiting to be matched. Well, in this example, donor 1 is matched with recipient 2. Donor 2 is matched with recipient 3. But if you come up here, donor 1, their family member, recipient 1, is here waiting for a kidney. And donor 1 is not going to give a kidney until their loved one gets a kidney. So it takes a non-directed donor to come in, find that they're matched with recipient 1, and now the chain can continue. This benefits the most number of people. Next is a brief discussion of the cost, safety, and the benefits of donating a kidney. So what are the potential costs? Well, there's a cost for surgery and workup, but fortunately that's paid for by the recipient's Medicare insurance. But it does take time for the workup, surgery, and recovery. You could have some lost wages, childcare, travel expenses. There could be psychosocial or cultural barriers, possible emotional distress because of the workup, maybe concern for the health of the recipient. Your motivation to donate will be explored. Knowledge regarding eligible benefits can vary. There may be a lack of support from family, friends, coworkers, and others. And there could be some cultural and religious concerns. So those economic risks, again, there can be indirect and direct costs. The financial burden will vary depending on your occupation, income, and ability of the recipient to pay for expenses, and knowledge of financial assistance programs. So how really safe is donating a kidney? Well, there are some surgical risks. Less than 3% of living kidney donation cases have major complications. 0.03%, there's a surgical risk of death within 90 days of donation. That is actually about the same as childbirth, and it's less than gallbladder surgery. The risk of developing end-stage kidney disease is lower in donors compared to the general population. And there's a higher risk of blood pressure in pregnancy after donating. It's not real great, but there is a risk, and it's important for anyone getting pregnant after donation to be followed. Donors live as long or even longer than the general population, and it's not really because they donated, it's because they're healthier. Are there really benefits after going through an unnecessary surgery? Well, most living kidney donors score high on quality of life health assessment after donation. They have a boost in self-esteem, they have an increased sense of well-being, an improved relationship with the recipient, and almost every donor says they would do it again if they could. My life is definitely better having donated my kidney. My only regret is that I only had one kidney to give. If I could donate more, I absolutely would. Have you ever wondered what it would be like to go through the donation process? The first easy private step is an online health questionnaire. You don't have to tell anyone, and it will determine your general health. If you pass, you can be sent urine and blood supplies to be tested at a local lab. Many people like doing this privately before committing to donating or telling anyone. Here are some websites that have online health questionnaires. And we have made it easy on the Kidney Donor Conversation website. On the homepage, you could just click see if you can be a kidney donor. And this is our website, www.mykdc.org. What does it take to be a kidney donor? Well, you need healthy teeth and gums. You need to be able to take off time for work, for testing, surgery, and recovery. You need to be able to pass cancer screenings. Blood pressure needs to be controlled. You shouldn't feel pressured or obligated to donate. You must be mentally stable without any suicidality, oriented to person, place, time, and events. Not pregnant. Lipid levels normal. Kidney, liver, heart functions normal. No diabetes or blood glucose. And you can understand short and long-term risks. The smoking, alcohol, and drug use can depend on the transplant center. So what could a kidney donor look like? Well, I need to be honest with you, this is not actual information about Will Ferrell. It's just an example of an imaginary kidney donor and what they could look like. They enjoy fishing, going to the beach with their kids, and watching Netflix. They're on one blood pressure medication. Family is concerned but supportive. They enjoy 2 beers a day. Their BMI is 30, which is actually just a little overweight. They've had a colonoscopy and a PSA. That's normal. They're on one antidepressant and they are seeing a counselor. Non-smoker, but has used marijuana in the past. Transplant centers have their own specific policies on this criteria. If you don't pass at one, you can always go to another transplant center and try. Let's say that you've been accepted to donate. So what does this surgery look like? It takes about 4 hours. Most often it's done laparoscopic with some small punctures and a small incision where they take out the kidney, or it could be an open incision where they make a larger incision to get the kidney out. The type will be determined by your transplant surgeon. After surgery, you wake up with one less kidney and incisions, oxygen, a Foley to drain your urine, a pump with IV pain medication, and a heating pad for comfort. Typically, you'll be given a stool softener every day to help with the ease of your very first bowel movement. And the first day you will be out of bed, taking a few steps and sitting in a chair. On day 2, if all's going well, everything is disconnected, you will then take pain pills and possibly be discharged. Donors are told to walk, walk, walk to help relieve the gas that was put in during the surgery. With 1 week, likely you will only need an over-the-counter pain medication, such as acetaminophen, no driving for about 2 weeks, and back to work 4 to 6 weeks. Patty on the right donated her kidney to Doug in the middle. He's now off dialysis and enjoying life again. This picture was taken about 1 month after surgery. So what does follow-up look like? They are typically at 6 weeks, 6 months, 1 year, and 2 years. You can lead a healthy life with one kidney. After one kidney is removed, it starts working harder to compensate for the missing kidney, and it may get a little larger. It now does all the filtering work to keep your body healthy. Many describe donation as a non-event. It's such a small aspect of their life, having the surgery, then feeling normal again, that they soon forget about it. Thank you for your desire to break the silence about living kidney donation and possibly help one more person live a longer, happier life. If you have questions or would like more information, to sign up for our monthly newsletter, read our educational blog posts, or talk to someone, you can reach us at www.mykdc.org. This is Glenna Fry with Kidney Donor Conversations.